Hi, everyone. Welcome to today's presentation on Bridging the Gap, Increasing Access to Eating Disorder Care Through Digital Solutions, brought to you in collaboration with the Eating Disorders Resource Center and Kahani. My name is Shivani, and I'm one of the managers of mission initiatives here at the National Eating Disorders Association, and I'm so excited to welcome you all here. I'd like to take a brief moment before we get started to talk about the National Eating Disorders Association and the Eating Disorders Resource Center. NEDA is a nonprofit organization working to fundamentally change the way eating disorders are understood and treated, and to empower those affected to achieve lasting well-being and recovery. Through campaigns like Eating Disorders Awareness Week and through our Campus Warriors and Care Fair programs, we are working to increase public understanding of these complex disorders. We also provide information and resources through the Grace Holland Cozine Resource Center, our toolkits, a screening tool which has helped over 1 million people, as well as through our educational programs like our Understanding Eating Disorders presentation and webinars like this. Additionally, we invest in innovative research that helps to develop and further effective treatments and work in collaboration with other groups to improve policies and systems to prevent eating disorders and expand access to quality care. The Eating Disorders Resource Center is also a nonprofit organization based in Campbell, California. EDRC's mission is to increase awareness and understanding of eating disorders for the general public, for the healthcare professionals, to promote early diagnosis, effective treatment and recovery, and also to advocate for mental health parity legislation and effective insurance coverage. Their staff and volunteers connect individuals struggling with eating disorders and their loved ones with local and national resources. Their services include a comprehensive website, a speakers bureau, weekly support groups, Ask the Expert series, educational outreach programs, and insurance advocacy. Your donations make educational presentations like this possible, so to learn more about our organizations and to donate, we'll share the links to NEDA and EDRC in the chat later. This webinar is presented by Mehek Mahan, who is the co-founder of Kahani, a personalized recovery platform supporting eating disorder care through evidence-based skill practice. A Sanford Graduate School of Business MBA candidate with a background in molecular and cell biology from UC Berkeley, she previously led AI and automation initiatives within Genentech's early clinical development team. She's passionate about mental health support with a personal mission to make eating disorder tools engaging, effective, and accessible. And finally, we're also joined by Dr. Sarah Raven, who has been a licensed psychologist for the past 15 years. At her Miami practice, she provides assessment and treatment for eating disorders, mood disorders, OCD, body dysmorphia, and related issues. She also provides consultations to parents who are supporting their loved ones' recovery. Dr. Raven is committed to nurturing those close relationships with patients and their families and creating individualized evidence-based treatment plans to help each patient achieve and maintain full recovery and prevent relapse. If you have any questions at any point during this presentation, please share them in the chat feature and I'll relay them to Mehik at the end of the presentation during a period of questions and answers. And before we get started with the presentation, as a disclaimer, the views and products shared by the presenters are their own and they do not constitute an endorsement or recommendation from NEDA. The aim of this presentation is to provide information on digital tools as they're expanding within our current landscape. You'll see a demo of Kahani, however, interest in using the app is based on your own personal discretion. Now I'll turn it on over to Mehek and Dr. Raven. Please feel free to take it away, and thank you so much for being here and sharing this with our community.
Well, thank you so much for that lovely introduction. We are so excited to carry forward a topic that is near and dear to our hearts around increasing access to care and what that can look like through the lens of digital solutions. Dr. Raven and I hope that this conversation is a joint kind of discussion so that we can really discuss some of the things that we're seeing anecdotally and then also some of the research that we've both done and really be able to facilitate that type of dialogue. So we wanted to start off by setting the stage and how our world has changed since before the pandemic to after the pandemic in terms of access to care and the resources and some of the different disturbing statistics we have seen around the increase in rate of eating disorders, alongside growing usage of social media, with some of the harmful effects being around increasing content that might facilitate thoughts around engaging in disordered eating behaviors and how we can think about using technology for good, knowing that the younger generations are spending more and more time on their phones. So, Dr. Raven, maybe perhaps to kick us off in setting the stage anecdotally and in your practice, if you can share a little bit more about what you're seeing, both when you were practicing before the pandemic and now, how has the landscape shifted?
I would say the landscape has shifted dramatically since the pandemic. I noticed an exponential increase in the number of people seeking care through my practice and through my colleagues' practices as well. I would say prior to the pandemic, I would accept maybe close to 50%, maybe a little less than that, of the people that wanted to work with me. Since the pandemic, I end up referring out at least 90% of the people that want to work with me because I simply don't have room in my schedule. The number of people in need has just increased dramatically. And so many of those tend to be very young people, elementary school kids, middle school kids, and then, of course, teenagers and young adults as well.
My gosh, that is a staggering statistic. And maybe speaking to some of the trends that you were seeing in your practice now around social media usage, can you speak to how much time you're seeing clients spending on social media and what types of content is being primarily consumed here?
Well, a lot of people come into treatment consuming a lot of social media content that's very body focused. Sometimes it's very health focused. And I put that in air quotes because a lot of times that's really, health is just kind of a code word for food restriction and, diet culture and that sort of thing. People follow fitness accounts, people follow food and nutrition accounts, what I eat in a day, how many calories or carbs do I eat in a day, those types of things. And that can be very, very damaging for someone who is struggling with an eating disorder.
No, absolutely. And kind of following through there in terms of further statistics around this idea of continued engagement and how do we make sure that people can stay committed and engaged in recovery in the periods between care is another type of topic that I think is largely related to the shift in the landscape. The bottom line being that no one should feel alone in care, but because of some of these discrepancies you're highlighting in supply and demand in terms of resource accessibility, we're seeing things like 5 month long wait lists for treatment centers, relapse rates being high if the off ramp after treatment isn't clearly articulated so that there's a skill set and a safety net for patients to be able to hold on to in finding their next form of tiered care. And to your point around referring patients out, I mean, patients are so lucky to be able to see you, and that hour a week is so special. And then what happens in the hours in between? How do they stay engaged when they get confronted with a challenging external stimuli or something that throws them off their game? How do we reinforce and harness the skills that we know are inside of us and that we learn in treatment, but maybe have a hard time applying to our day to day? So just kind of doubling down on the statistic that you had shared around anecdotally referring out 90% of your patients. Here we can see that based on the research we've done, there are about 3,000 people per psychologist in this day and age. And that is a staggering number as it pertains to accessibility of care, real time engagement, and that level of continuity so that recovery isn't staccato. It's more so of a beautiful continuum with its ups and downs. So, with that, we wanted to move into the promise of digital solutions because we painted a picture that might seem a little bit bleak right now, but there are things that could work, and there are opportunities where we can leverage this idea of the technological inflection that we're seeing and how this can complement treatment. And so, we'll say this a couple of times throughout the presentation where the promise of digital solutions, as we are presenting in this webinar, is not as a replacement to any type of treatment. It is to complement and be an adjunctive type of support to enhance that level of commitment and continuity throughout. So we've kind of bucketed this into how digital solutions might fit into treatment around accessibility, around evidence-based support, and that real-time skill application to external stimuli. And we know that this is possible because of some of the real benefits that we've been seeing in the technological inflection point that is generative AI. We will get into the risks and concerns and around privacy and security around leveraging this type of technology later in the presentation, because those are extremely important to highlight. But for the context of this slide, we want to highlight this beautiful marriage of an opportunity here to bring more types of products to patients who need it, because we know that recovery is not a one size fits all. So, Dr. Raven, how do you see digital solutions fitting into treatment with the practice that you do?
Well, one of the major differences that I've noticed between when I started out in my training, and I would say like the early 2000s to now, is that I used to photocopy worksheets and things like that to give to people, and that sounds very dated right now. And now kids don't, they don't want to put anything on a worksheet or pen and paper. They're on their phone all the time or on their computer all the time anyway for school and as well as for social things. So given that they are so fluent with technology, being able to adapt, treatment skills and ways of coping and even support, that sort of thing, to the digital environment that they're already in and that they've grown up in, I think makes it much more attractive to teenagers and college-aged young adults.
Absolutely. And going, so in that vein, one thing that we're seeing here in terms of the landscape is that there are over 1 million apps on the Apple and Android store, but so far only about 20 or so that are either specifically eating disorder related or tangentially related. And that's not good enough. So we need to invest in more apps and more options, because to your point, this new generation of patients is digitally native. We are all glued to our phones at this point. And so how can we think about tools that can fit into our day-to-day routine seamlessly without causing us to break habits in different ways, but instead allowing us to harness the tools that we use and are glued to for positive reasons and for healing. So that brings us to what we're seeing in terms of the buckets of digital types of tools. Before we go into these 4 buckets, I'm curious, for those of you listening, if you've used any of these tools. If you can drop that into the chat, have you played around with any of these types of apps or resources? If so, I'm curious which ones. And this is one where we can talk through, Dr. Raven, some of the trends that you're seeing with your patients in terms of the types of tools being used. So we see this in 4 buckets right now, where we've got our trackers like Recovery Record, which do an amazing job allowing folks to be able to really dive into real-time data on what are they consuming and what are the emotions around that type of food intake, and being able to share that with their providers. We also have apps that are kind of more generally meditation based, like the Headspaces and the Calms, which are not eating disorder specific, but kind of help with that real-time grounding and have kind of set the stage and paved the way for technology that becomes more like an integration into your potentially your daily routines, your morning routines, types of habits that you want to start to cultivate. Then we have tools that are more framework oriented. So the picture here is of DBT Coach. There are other apps around CBT and ACT that are more so like workbooks that allow for resource presentation and educational content, but are less so personalized to potentially your individual needs and more so increasing access to the types of tools that could be useful for you. And then we've got our habit games. This one's a new one that maybe you've heard of. I can't see the chat right now, but maybe if you've played with Finch, that's an example of a tool that is particularly gamified around habit tracking. And so we see this whole group of gamification tools kind of coming about. We haven't really seen one yet for eating disorders. In these 4 categories, Dr. Raven, where do you see patients kind of in terms of, digital health landscapes as it pertains to recovery? Where do you see your patients falling?
I would say people in early recovery have made really good use of Recovery Record when you're still in a stage of like being able to track your meals and identify what your triggers are and any type of compensatory behaviors. I think Recovery Record can be very, very useful at that stage of recovery. And then others that I have, especially those that are young adults, maybe who've been recovered for a long period of time and are just interested in cultivating a healthy lifestyle, managing stress and anxiety, the apps like Headspace, Insight Timer, Calm, those can be very, very helpful for people that are really just trying to establish good mental health habits for life. The other two I'm not so familiar with.
Yeah, that's a really great point, because that brings us right into this idea that you just mentioned around where are people in their recovery journey, and at what point might digital tools be useful for someone, and at what point may they not be. So, in one idea we had here in terms of what we can use to determine if a tool is appropriate for someone is kind of focusing in on this idea of adjunctive. So these tools can be really, really beneficial if we can use them in parallel with a care team. And if there's also that motivation to try out new tools. Not everyone is in the place in which they are excited to try out the next type of tool or a resource. But if you are, this could be a good fit. Individuals who are in recovery or in maintenance, to your point, where are you on that journey? And are digital tools something that are exciting for you and maybe potentially either native to your style of learning? This is also really useful for patients who need reinforcement between therapy sessions for concepts that you learn. But it may not be super useful for those requiring intensive medical supervision, in which potentially, the previous period of care, or the foremost period of care for those patients, may be in the weight restoration phase, or in medical stabilization around vitals, before we can get into some of the cognitive and emotional framework stage. And so we kind of think of these as two of the buckets in terms of who might be a good fit and who might not be. Did I miss anything there? What else are you seeing in terms of patients who really like the digital tools?
I think the issue of motivation and commitment to treatment is important to mention, because as probably most of us watching this webinar know, motivation and commitment can be very tricky issues in eating disorders that can wax and wane. And very often early in recovery or mid-recovery, there may be very little, if any, motivation, or people have a very hard time being committed to treatment. And I think using an app does require some motivation, some commitment, but we can naturally expect those things to wax and wane. So I think being committed to using an app, if one is not committed 24/7 to recovery, which honestly most people aren't, that can help to enhance the motivation. If someone's like, oh, I need to log on to this app and I need to do these exercises, I think sometimes that can give them a little boost that they need between sessions to keep going on the right track.
I love what you just said right there. Absolutely, because I think sometimes we can, to your point, think of motivation as binary, and that's not necessarily always the case. It is very much, as you said, a waxing and waning, and that hopefully decreases the barrier to thinking, is this tool right for me? Should I use something if I don't feel particularly motivated toward recovery in this moment? Yes, because maybe in the next you will be, and maybe in the next you won't be, and that's okay. That is all part of the process. So, as we think about what other tools are useful for us to think about, or what other concepts are useful for us to think about here, we want to make sure we do spend a couple of minutes on safety and privacy best practices. So, because we are talking about the new technological inflection point and some of the opportunities around increasing access and this real time support that is deeply personalized, we would be remiss if we didn't mention that there are other parts of this technology in which are new and still being figured out. So some of the things we want to make sure we talk through are around user data never being shared without consent, being a super important pillar. Clear representation of what this tool is and what it isn't, as we mentioned in the slide before. Safeguards around triggering content, clinician oversight where appropriate, security and evidence-based content. It is very easy at this point to get apps out that tout certain things and abilities when they're not really backed in evidence-based frameworks. And so it's really important to, again, with the pillar right above it, being clear in the representation of what this app is versus what it isn't. And then, of course, resources for escalation of care. That usually apps are not a one-stop shop for everything. And when a patient is in crisis, the app is likely not the best place to land. So how do we ensure that we have the right types of escalation methods so that that person is getting the right care that they need in the moment that they need it? So wanted to mention that because this is very, very much top of mind. And so, as we think about what type of solution might be the most beneficial, and we're happy to kind of go more into these slides in further depth, but I want to make sure we can get to a demo of what we're working on here at Kahani, because Dr. Raven's been able to play around with that, with this app, and been able to use it with some of her patients. And we want to make sure you can see an idea of what a new type of tool might look like, and if it's of interest to anyone listening. So this idea is really rooted in this idea of for patients and for providers, how do we integrate the best of those 4 buckets of digital solutions and create a personalized recovery experience that is a self-directed therapeutic skill practice in partnership with your medical team and allows for that integration in becoming kind of that real-time recovery companion. And for providers, being able to see how your patients are in real time tracking their progress, managing that curriculum, and potentially being able to see signs for proactive relapse indicators. So we developed Kahani in collaboration with Stanford clinical psychologists, and our models really integrate real-time assessment with these micro interventions. So we have a clinical curriculum we'll show you. We have this deep idea of personalization, which we will show you, and this idea of holistic assessment. Maybe this sounds out of left field, but a big part of our ethos is to make recovery feel a little bit more like play, which in our minds is a core part of the human experience. It doesn't necessarily always need to be fun, but it is challenging and it is rewarding. And most importantly, it honors the holistic parts of who a patient is and puts recovery in the context of your North Star, your recovery why you are committing to recovering, what is meaningful in your life. And that is really the ethos of how we thought about building Kahani. So I want to show you that because usually this is much easier to contextualize when you can see a demo of where we're at. So this is Kahani. When we come into the world, it is largely based on an island vibe meant to make you feel like you're in a beautiful landscape, where right here in this very first piece is our assessment island. In Assessment Island, this piece allows our algorithm to understand why you are coming here today. What is important to you for recovery? What are you hoping to work on? What are your relationships like? What are your coping mechanisms like? So as an example, you might go into Community Cove and we might be able to see here, for instance, what are our supportive family dynamics like? What does that look like in our world? If we go up to a little task here, how do we navigate boundaries when it comes to our communities? So all of this information in Assessment Island is going to give us an understanding of who you are as a person, and it unlocks all of these lands up here, which are rooted in cognitive behavioral, dialectical behavioral, acceptance-based, and mindfulness-based therapies. So as an example, we might go into one of these islands and start a task here around mindfulness. So this would be anchoring in calm, mindful breathing. I'm going to go through just a couple more examples of what types of skills you might practice, and then I'd love to hear Dr. Raven talk through maybe some of the things that she's seeing with her patients. So in this island right here, this would be an important opportunity to cultivate self-kindness, embracing your inner ally, tasks that are maybe more act-based, so facing fears with acceptance and how we can go through and investigate maybe potentially unhelpful thought patterns. And here, maybe building a supportive coping toolbox. So these are all meant to be non-advice related, but primarily supportive in Socratic questioning. So how do we get someone to investigate potentially unhelpful thought patterns and put them in a context where they can feel empowered to have their own resources built out in this land that is deeply personalized to what you're hoping to work on with your treatment provider and in recovery. So these are some of the examples of the types of skills that you might be able to practice in the world of Kahani. And I want to ask Dr. Raven, what have you been seeing with some of your patients? How have your patients found value in using Kahani? And what are some of your ideas for how this could be useful for other patients?
Well, as a disclaimer, I'm very, very new to using Kahani, so I only have a couple of points of data here. But I found a couple of people have really benefited from the serenity, the calming things, particularly those who struggle with getting very overwhelmed, maybe at nighttime, and may have episodes of binge eating or purge eating at night, and are really just, their first instinct is to look at their phone and like look at their social media or play Candy Crush or something that's not necessarily the worst, but also maybe not necessarily the most helpful thing. Yeah. Being able to use some of those calming tools, some of the mindfulness based tools to calm their nervous system and to kind of center them and ground them, I think has been very, very helpful. And they're more likely to use it than they would be to use, let's say, a worksheet or something verbally that we had discussed in session where they don't have like something tangible to hold on to and to look at during those moments.
Yeah, that's very exciting to hear, first of all. And it's bringing up something interesting that we had talked about, I think, a couple of days ago in terms of how can we leverage Kahani as a type of circuit breaker of sorts. So how can we pair it with potentially an unhelpful coping mechanism or a time of day, or to your point of maybe a behavior like maybe time spent on social media? And how can we integrate the usage of Kahani either in a time-based method of say use Kahani for 5 minutes, or in a task-based method of maybe do 2 or 3 tasks and then think about if you want to then engage in said behavior. And what that in our minds may be able to provide is an opportunity to break that inherent pattern of I have this thought, I'm going to act on it and then deal with the consequence. And so thinking about how we can leverage some of our CBT, DBT, and ACT-like principles in real time by investigating, is this actually a behavior that's going to serve me? And if not, what is something else that will serve me? And a lot of these activities in the app are ones that can help create your own toolbox. As we saw, we have a coping mechanism toolbox. There's another activity around crafting a life worth living and what does your vision for a future look like? And so reminding you of the things that brought you to recovery in the first place.
Exactly.
That is beautiful. Thank you for sharing that.
Of course.
All right. And so with that, before we say goodbye to Dr. Raven, who might have to jump in a few, we just wanted to quickly go back here to our key takeaways. So something that is really, really important, these 5 pieces, if there's nothing else you take away from this presentation, there is something really real here about the potential of digital solutions to close the 167-hour gap in between weekly sessions and allow for that continuous engagement, to think about harnessing the power of play for healing, and to adapt these evidence-based techniques in a way that is deeply personal for each individual and each individual's goals and personalities. Thinking about this as an antidote to some of the social media content that just might not be helpful and might actually be harmful in trying to get to a place in recovery in which you feel you're most centered and empowered. And finally, through this idea of using technology for a curriculum that is tailored to you, we are really rewriting this narrative of a one-size-fits-all idea where every individual story must be uniquely honored and therefore presented in the types of engagement that works best for you. And that's actually where the name Kahani came from. It is a Hindi word meaning story, and the meaning behind that really in how we interpreted this for this application is that everyone should have the right ability and empowerment to write their own story. And that's the ethos of what we wanted to be able to convey in this recovery journey and in this type of tool. Hopefully we are one of many tools that come out of this type of environment and allow for people to have that optionality. But at the very least, we can start to pave the way for an idea of bringing gamification and bringing this idea of personalization to recovery in a way that integrates with your day-to-day activities. And we are always available for any sorts of questions, concerns, excitement to use the app. If there's anything that comes up, please feel free to email Dr. Raven or myself, or visit Dr. Raven's website where she has a lot of amazing content where you can learn a little bit more about maybe different questions that are top of mind.
Thank you very much for having me. It's been a pleasure and a privilege to work with you, and I wish you all the best.
Thank you, Dr. Raven. Okay, Shivani, I think we are ready to dive into any questions that folks might have, and I'm happy to dive deeper into any of the slides that were presented. I know I ran through them a little bit quickly so that we can make sure that Dr. Raven was available for all of the different parts of the presentation, but happy to go into detail into whatever folks are interested in.
Okay, thanks so much. I do have a couple of questions already, but I did also want to dive into the fact that there are a couple of people in the chat that have used apps. It seems like Headspace is the most popular. There are people that have used the Habit Games app and also Finch. And then some are interested in working with Recovery Record, but it seems like Headspace was the most used.
Amazing. Okay, thank you for that. Very, very interesting. I certainly love Headspace myself.
All right, everyone, if you have questions, please feel free to drop them in the chat. The first one that I got is there an intended age group for Kahani?
Great question. So we have designed this likely for the teenage and young adult population, which we believe will probably be using this type of technology the most frequently. However, I had an interesting conversation a couple of weeks ago with a clinical psychologist who sees primarily patients in their 40s, women in their 40s specifically, and she had this thought that a lot of those women love Candy Crush. And so there is kind of an opportunity to think about engaging with another type of app like this in parallel with a habit that already feels very comfortable and natural for another type of demographic. So as we are very early, I'm really excited to see the different types of populations that might benefit the most. But specifically to answer your question, in thinking about the design and how we initially built this out, the age range was initially intended at least for teenagers and young adults.
Awesome. Thank you so much. Again, please feel free to use the chat feature, the Q&A. I have access to both. So any questions, not even only just for Kahani, but for digital tools in general. Hick has a pretty great background and can answer any questions that you have. Someone's asking, would this app be only available to eating disorder patients?
Okay, great question. So the way we designed this, and I think this actually answers the follow-up question a little bit as well around does Kahani address co-occurring issues? So we initially developed this app to be one in which we want to focus on eating disorder recovery. This is deeply personal with my lived experience and that of two of the closest people in my life. And so wanted to be very specific in the way that we trained our algorithms to be able to answer questions that are specific for eating disorders. However, we also know that eating disorders do not exist in a vacuum largely, and there are a lot of co-occurring conditions that, for a lot of populations, there is a lot of opportunity for that translatability. Because we are using principles that are rooted in CBT, DBT, and ACT, there is a lot of opportunity for this type of Socratic line of questioning and evidence-based framework to then be addressed to, let's say, substance abuse or depression or anxiety. We haven't tested those as yet, but that is kind of an initial working hypothesis. Alongside, we've talked to a couple of therapists and dietitians who have mentioned that patients with OCD or borderline personality disorder or ADHD could benefit largely from using gamified tools like this. And so there is opportunity, I think, to expand to lots of other types of conditions. And as we're seeing more people start to use the app, we're kind of learning along with you. I guess one other point on is this only available for eating disorder patients? No, this will be available for you to use. I think in terms of effectively using this kind of app, for instance, downloading it on the App Store, using it in partnership with a treatment professional, I think will be helpful for accountability and motivation. But we could also see it for disordered eating, right? Going a little bit more upstream, where maybe you want to use something like this to set goals for yourself and improve your relationship with food. And maybe you haven't been formally diagnosed with an eating disorder, but that's something that might be in the back of your mind. And so there are certainly options there to be able to cater the experience to your needs because the recovery curriculum is catered to whatever you input into the assessment.
Thank you. It seems like we have someone outside of the US. So is this resource available to people outside of the States, or do you have any other tools or resources that someone can use in Canada or internationally?
Yeah, so this will be largely available on the App Store. It's already in use with some folks in the US, but this will be available in Canada for sure. And then in terms of other types of resources, I think aside from the apps that we've spoken about that are largely available across the world, this is one where I think the EDRC and NEDA resources have been, at least for my community and the folks that I'm in touch with, very, very beneficial. And there are lots and lots of opportunities to think about which resources is best for you. That goes out in newsletters for both. And so I would highly recommend leveraging some of the options there.
Okay. So two other questions, I'll pair them together. So how do you access Kahani? And then is there a fee with Kahani?
Yes. Okay. So accessing Kahani, right now, since we are kind of in our first phase of rollout, please email me directly and I'm more than happy to give you access. We have kind of a version that is free, and then we have a version that is $20 a month per patient. And that is something around just in terms of the features that you have access to. So please reach out and more than happy to see if we can work something out to make sure that the people who want access can get access to Kahani.
All right. This is a question around the safety protocols. So what are some safeguards if a user starts bringing up disordered eating habits?
Yes, great question and very important in the way that we considered thinking about the safeguards around the model, how we've prompted the model to make sure that the answers that we receive are ones that are constructive rather than destructive. So largely when a patient mentions any type of self-harm, suicidal ideation, or ways to continue engaging in disordered behaviors, our model will kind of pause the task at hand and provide a response that contains resources around the NEDA hotline, crisis hotline, or the NEDA website, crisis hotlines, and other types of resources for medical professionals. It also is very clear in that message that if this is a time of crisis, please go ahead and call 911, and that this is not a replacement for medical help. So that is mentioned a couple of times in the app. And when behaviors like this are asked to engage further, and the model is quite conservative in making sure that we do not offer any type of destructive advice, nor advice kind of in general. Because we've created the model in a very Socratic line of questioning format, you will likely not be getting any types of advice for how you should live your life or what you should do, more so asking yourself, what do you think would be best for you? So we will take that very seriously, and we have taken that seriously in the model and tested it quite extensively.
Okay, thanks so much, Mahek. With so many tools on the App Store, how does someone know when they should be engaging with their treatment team or when they should be on the tool?
Great question. So, yes, there are so many apps on the App Store, and at some point, the way that we've thought about using Kahani right now is there is this opportunity for using it whenever you feel like you need it. We can also see that, as with human behavior and human change, and as Dr. Raven mentioned around kind of the waxing and waning of motivation, we might not always remember to pick up Kahani and know that we need to use it in a moment where we're deep in a social media spiral. So, the way that we think about kind of building this into your lifestyle and into your recovery process is how we mentioned around this idea of pairing with your treatment provider. And so, at least in the beginning, we find that this idea of the external motivation and accountability from your treatment provider, as well as maybe your internal drivers around the goals that you want to work on, in conjunction will allow us to basically use Kahani for specific things. So initially, we might target one challenging coping mechanism at a time until it becomes more natural. And then it'll feel more natural to pick up Kahani when you're having maybe a destructive thought, or you're kind of spiraling about something and need a resource and a way to pull back out. It might become second nature at that point to use Kahani. But we kind of imagine it being a bit phased in that sense.
So when do you know when you're over relying on an app and how do you avoid this?
Yes. So this is an important concept where it is easy, I think, to at times convince ourselves that maybe we're making more progress than we are. And there's this idea of pseudo recovery, right? Where it might feel like we are doing all the things that we need to be doing, and yet maybe that's not translating completely into our behaviors. And this is where I want to highlight again that Kahani is not a replacement for treatment, and it is not a replacement for a medical professional. And so I think the opportunity to use Kahani, over relying on it, is one that can be mitigated by the oversight with and integration with your medical team. So together you would be able to have this opportunity to share what's working and what isn't working for you, and your treatment provider to be able to dig deeper and pull on the threads that might be indicative of if Kahani is being over relied on or under relied on, and be able to toggle and mitigate from there.
Okay. I guess it's more of a logistical question. So there are other apps in the Play Store containing the word Kahani. Have you considered or tested this during your development?
Thank you, Joan, for that. That's a great insight. Yeah, it's hard these days to find a name that isn't taken. We will, if you email me, we will give you direct access to how you can download Kahani for your usage. And it'll be kind of listed as our domain name is www.getkahani.com. And so that has given us a bit of a our unique angle there. But to your point, yes, are there any ideas that are not taken at this day in this day and age is a great question. So hopefully we're going to be able to find ways to share out the message of Kahani through the people who are using it with word of mouth and retention. We have a really strong group of early clinicians who are using this with their patients, and I think that type of familiarity will then be able to breed more awareness naturally.
Awesome. So what sets Kahani apart from other eating disorder apps?
Great question. One thing we thought pretty deeply about is, as a kind of as I mentioned earlier in the presentation around this idea of play, we don't really see any apps out there that have this kind of unique overlap in the Venn diagram of personalized care, continuous engagement, gamified environments, and this pairing with your clinician. And so together, we see this as being quite different from the other apps that are on the App Store because um, not only do we have these four different categories, um, we are kind of solving for a slightly different pain point. So apps like Recovery Record are phenomenal for being able to keep track and record of what's going on in your day to day and kind of more tactical data for your clinician. What we're solving for is that period of continuous engagement and reinforcing skill sets that you learn in those 167 hours in between your weekly therapy or dietitian sessions. And so, for what we see right now, there aren't other products that are doing that in the way that is uniquely gamified, uniquely personalized, and uniquely kind of integrated with your team. If there are, please do share my way. I haven't seen any others like this on the App Store. But if there are others that you've seen, please share them. I'm always curious to learn. And in my mind, more opportunities are better. So it is better to have as many apps as possible that are doing things that are hoping to solve for real pain points because everyone's different and maybe something will work for one person and not work for another.
Great, thank you so much. I don't know if this was said during the presentation, but does Kahani help folks with all types of eating disorders, including like ARFID?
Yeah, so Kahani was designed to be transdiagnostic, largely in real life testing right now. We've seen this with restrictive and binged, so anorexia patients, binge eating patients, and bulimic patients. I haven't heard of a case of a patient right now testing with ARFID, but it was designed to be able to kind of encompass the range.
Um, we still have some more time, so if you have any questions, I'll give it a minute. Feel free to drop them in the chat or the Q&A feature. Um, I'll just give it one more minute.
Yeah, I'm very grateful for the engagement. Thank you for all of these real-time questions and for the passion and excitement. I hopefully you can tell how excited I am about this space, and there's a real opportunity to bring something beautiful to people who need it in the times that they need it.
I think that might be it for questions. Just people saying thank you for creating the app.
Yeah.
Mahek, was there anything else in the presentation you wanted to quickly go over or?
Thank you so much for the time, everyone. You have my contact information, and I am always around to be able to chat about this. I'm deeply, deeply passionate about what we're building and very open to any suggestions and ideas you might have. Our real hope is to build a community that is excited about this potential for new solutions to solve a problem that really, really needs more attention and support and care. So, any and all ideas, I'm very grateful for. So, please, please, my door is open.
Thanks so much, Mahek. I'm going to drop a couple of things in the chat for you. So if you are interested in getting paired with your treatment provider with Kahani, that is Mahek's email address. So please feel free to directly reach out to her to support future programming like this. Thank you so much for EDRC for partnering with this important presentation. We would appreciate any donations. And you also just want to drop in a survey link. We value your feedback. This really helps us to incorporate into future webinars like this. Thank you all so much for joining. Truly appreciate it. Mahek, thank you so much for joining. Hope everyone has a good night.
Thank you all.